Hi, Mark again from Capital Podiatry. I thought today I'd talk about another condition that we see quite a lot of, and it's called tib-post dysfunction, or tibialis posterior dysfunction, also called tibialis posterior tendinosis. This is a condition that can be particularly dangerous if it's not picked up and treated in time. So what you have is a muscle in the back of your leg called tibialis posterior. Its tendon runs down the back of the leg and then it comes around the inside of the ankle, and its first attachment is to the navicular bone down here. So it's one of the prime muscles that helps maintain the arch and control what it does. Now, for some people, they start developing pain in the tib post, usually through a combination of how their foot moves and what they're doing. So if they've got a foot that in particular has a large range of pronation and supination as they walk, and they do something out of the ordinary which is involves more exertion than normal, this tendon can get grumpy and it can get overloaded. And classically, it's where it comes round the heel along here to its attachment and through there. So the end result of this, if it goes untreated, is it gets more and more sore. The soreness works its way right up the back of the leg to the belly of the muscle. You get swelling on the inside of the ankle, and eventually, again, if it's untreated, it gives way and the foot collapses, and you end up with what's called an adult acquired flat foot. It's pretty nasty. It means that the people who get this for the rest of their lives have a boat-shaped foot, with what used to be the arch being the lowest part of the foot, and they have to walk on that. And it's just like a dead, flat pancake foot. And then they get all sorts of issues with joints and muscles and ligaments from there on in. Now, don't panic, it is treatable and it can be turned around quite quickly. This is one of the conditions where I always go for a customised orthotic. You have to give that tendon a break and stabilise it and help adjust how it moves through the gait cycle. So that's the first part of it. There is then, it's a case of starting to do some rehab, doing the mobilising the joints, doing fascial massage, and a program of rehabilitation of the tib post muscle itself to the point where everything can turn around and we can get rid of it completely and safely. The other consequences of tib post starting to give way is if it stops helping to support the arch, people often start developing plantar fasciitis, so they get pain along the ligament underneath their foot and particularly at the heel, so it's a related condition. It also, because it also attaches to every bone in the midfoot, people get this vague aching pain through the midfoot sometimes, and if the tib post is giving up and the plantar fascia is giving up, you start getting more, because the foot isn't being supported through gait, it starts to bow that way, and you start getting calcification on the top of the foot, and you can get pain and dysfunction through there as well. So supportive footwear is also a biggie, and it's very, very important to have a look at what you're actually doing function-wise and adjust that, and that's all the sort of issues that we go through and to sort it out. But as I said before, the good news is if we catch it in time, we can do something about it and fix it.